Madam, please stay on stage, and I invite Professor K. Mohana to give away the result and elaboration on the research papers.
So we have the three awards for the abstracts. So Professor K. Mohana will give you some about overview of your research papers.
Good afternoon, everyone. I'm sure you must be very tired, but I really am delighted just to have a few minutes of your time to congratulate you on your presentations today. I really enjoyed them all. And you know what the most important thing was? For me, they demonstrated the true heart of family medicine. So we had presentations about diabetes distress, such an important topic. 37% of diabetic patients suffering with diabetes distress. So lovely to be thinking and to be worrying about this area. We had several presentations thinking about malnourishment at the other end of the malnourishment scale that we sometimes are directed to. So we had presentations on obesity, high BMI in pregnancy, related topic of gestational diabetes, and so important, looking at child and adolescent knowledge of the color coding of high glycemic index foods. As somebody just said, we are right by the patients, alongside the patients, and to be interested in these topics really very important. One of the observations I was making yesterday is about the fraternal relationship we have with our friends in public health. And I was so pleased to see two presentations, one on the public health principles as applied in the COVID-19 pandemic, and another one in the Australian Queensland response to the recent floods, last year floods. Then we had three really fascinating presentations, case presentations, again demonstrating the heart of family medicine. A very distressing story of a patient living with Down syndrome who had Norwegian scabies. So important, such a simple diagnosis to make if you catch it early, and so horrendous if it's left. What about sudden vision loss in SLE? We don't think about this so much. We need to be monitoring and supervising our patients because we are the ones close to them. That was a very interesting case report. And then we saw schizoaffective disorder presenting as chest pain. How common is chest pain? And how important we learned to take a full, proper family medicine, holistic history in order to make the assessment. So I think I want to thank you all for the great honor you gave me as being part of the judging panel and listening to all your work. I missed the one about feeding practices in 12-month-old children. I leave this one to the end because I just was so fascinated to find the percentage of mothers feeding their children whilst doing something else. And there was some, like for example, working or talking or doing the laundry. The reason I mentioned this one last is because actually there was some surprise in the auditorium about, well, this is a high percentage of women focusing on something else when they should be feeding their children. How about this skill as multitasking? So mothers multitask and family physicians multitask. We're always doing something at the same time as something else. And I know that all of you who are presenting today were running clinics, we're having families, we're having social commitments, and we're doing research. And the quality was really, I should commend you all for that. But my final word goes to your teachers and your supervisors. I can see their hand in their work with you. And I just wanted to give acknowledgement to all the supervisors for the trainees and colleagues who presented today. Thank you very much.
Thank you very much, ma'am. And to give away the awarding of certificates and the results, I would like to invite Dr. Lalanta Senaratna, past president of the college, and Professor K. Mohana to give away the certificates to the winners.
First thing is to the best poster presentation and this best scientific paper and the best presenter. First of all, I would like to give you the results for the best poster presentation. It is number PCA2, a case report of functional neurological symptoms disorder masquerading as paraplegia. So the winner is Dr. Patiratna TV. Then I would like to go for the best presenter. This is regarding a case report, sexual affective disorder presenting as chest pain in female patient, OCA number 8. Dr. Seniviratna, RASM. And the best scientific paper. So it's utilization of field health services among pre-pregnancy excess weight mothers in Gampar district. Dr. Mahanama, LPK, SN. Thank you very much for everybody who participated for this, and as presenters, thank you very much for everything and your hard work. We really appreciate your work. Anyway, we hope even for the next time you will present all your abstracts. Thank you very much.
Thank you, Professor K. Mohan, and thank you very much, Dr. Lalantha Senaratne. And moving on, we had a raffle draw, and we are about to select the winner right now, courtesy of Mankind Pharma, a one-night full boat double room for Alia Resort, Sigiriya. So I kindly request the company officers to come forth, and requesting the president of the college, Dr. Ms. Malkanthi Galhene, please come on stage to continue with the raffle draw and to give away the prize for the winner. So we have all the names of the registrations, and we will be having this digital wheel to select the winner. And that's Dr. Chaminda with the mobile number 0773230835. Is Dr. Chaminda here? Is he here, Dr. Chaminda? Okay. So please inform him. And so Mankind Pharma, the company representation, can give the award to the prize to the president of the college, so that we can communicate with the recipient. Yes. And you all can contact the winner, and you all can give the actual ticket or the receipt. So the winner is Dr. Chaminda. So congratulations to Dr. Chaminda, and thank you very much, Mankind Pharma. And next, I cordially invite, I once again invite the president of the college, Dr. Malkanthi Galhene, to come forth as to give away the felicitations for the sponsors, because they are a part of our event as well. Madam, over to you.
Good evening to all of you. Since we have come to the end of this, only one or two the items are there to finish. Before that, I must thank all of our sponsors, including the diamond sponsors, to even the sponsors who have given us their contribution by giving advertisement. Thank you so much. Because of you all, we had a good, the time to, the go ahead with this very successful 2 scientific events, pre-congress, as well as yesterday the inauguration ceremony, and today the scientific event. So on behalf of that, we have arranged some sort of acknowledgement by giving you all to your sponsors to the plaque to commemorate our gratitude to you all. So thank you so much again. I'll invite currently on behalf of all pharmaceuticals, we have kept all the plaques ready for the appreciation to send to your country office. So I would like to invite to George Stewart, then Transpharma and Mankind, currently who are with us now, and the rest of the plaques will be delivered in due course to them. Thank you so much, and I wish you all the very best for the pharmaceutical industry as well as to your future. Kindly please come to the stage.
Can a representative from Transpharma come forth? Thank you very much, Transpharma, for being a part of these inaugural scientific sessions and the inauguration. And a representative from Mankind. and thanking mankind as well for their contribution for the success of these scientific sessions. And for George Stewart, as I'm from George Stewart, I'll be receiving that award. Thank you. Well, it has been a fruitful inauguration and scientific sessions for our college at the inaugural ceremony. So looking forward for more glorious days ahead, but as I said, all good things come to an end. Would like to invite Dr. Lalanta Senaratne, past president of the college, to give away the vote of thanks.
I must say it's a very successful day. Actually, it's a successful series. Behalf of the college, actually, not behalf of the college, I actually wanted to thank you as a chair of the scientific committee to all the contributions from the registrars to senior registrars as well as the acting consultants and consultants, because they have done a big job. Starting from the finding topics, finding lecturers, the presentations, as well as, there are a lot of obstacles for us to finding some researchers, finding good research papers as well. And I must thank the abstract committee to find what are the good papers, because we had to limit to 10 oral presentations as well as 5 poster presentations. So it was a difficult task to choose what are the best 10 oral presentations and what are the 5 good oral presentations. Out of them, we had to choose 3. Anyway, it's a big task. So not only our scientific committee, not only our abstract committee, there are a few committees, the financial committee as well as inaugural committee. That is how we did. We not we did everything by ourselves, but we nicely grouped, but it's mutually we support each other. But anyway, because they have some sort of separate responsibilities. Because of that, they have fulfilled their job very correctly. And I must thank you for everybody. And I must thank all the pharmaceuticals, as I thank the hotel as well as our event organizer. Especially, I thanked him before he left the place. Anyway, it's a big event. Though it's inaugural session, it's not inaugural session. I must thank for everything. I'm very proud to say most of the college presidents who participated, they want to have a collaborative sessions with us because the way we conducted it. And I must thank our current president, Dr. Malkanthi Galhena, as well as the secretary, Dr. Priyantha Halambarachi, as well as all the council members, including our Assistant Secretary, Dr. Prabhat, as well as Dr. Sindupa, and other council members who did it, their immense support. Especially, I must say, don't misunderstand me, there are people who did a very, the dedication and everything. Especially, I must say, Dr. Shane Halpe, Dr. Lakmal, they did a very big thing, because without them, we cannot think what we can do. Okay, so for everybody, our senior consultants, our acting consultants, as well as the senior registrars, they did a marvelous job. Without you, it's a dream for us. Thank you very, very much for everything, and I hope this support will be getting this same kind of support or more than that in our next scientific session. Thank you.
Dear Madam, I believe you have one more notice from Madam.
Today, at the end of this session, a very successful session, I would like to thank to all the committee, all the members and non-members, as well as the university, the support from University of the Sri Jayawardenepura, and as well as the University of Batticaloa. Especially the Dr. Aruni De Silva and Dr. Hirantini De Silva, as well as Dr. Arulanandan, who was with us from the beginning. So we have to appreciate, as well as Professor Kumar Mendis from Sabaragamu University. So I'm really, really grateful for you all, and we would like to have your support in future to go ahead together. And as well as I am going to announce for our fellowship dinner, this is the custom for all the people who have contributed for this untiring work, and they have worked day and night. So because of that, I would like to ask Dr. Prabhat and Dr. Lakmal to decide a date because of they are having exams coming 29th or that. So first week of December, at your convenience, we would like to inform you all to have the fellowship dinner, and we have to celebrate this, and it's a very successful event because of you all. So our fellows, all we have to be together. Thank you very much. All the very best. And I wish you all very happy evening today, and to have very best future. Thank you.